The cost of treating asthma is enormous and growing, and it's becoming clear both inside and outside the medical profession that just reaching for more and more inhalers is not going to solve the problem.
The evidence is that Ventolin is overused. You can take a ton of Ventolin today and it doesn't make your asthma any better tomorrow.
Recently, an apparently bizarre new treatment called the Buteyko method has arrived in Britain. Its proponents claim that asthma is caused by over-breathing. So the answer's simple. You improve your asthma by learning to breathe less.
If the theory is true, it is going to completely change the way that we think about asthmatics and possibly some other conditions as well.
The Buteyko method was developed in Russia by a leading physiologist, Professor Konstantin Buteyko. After initial skepticism, the technique's been used extensively there for the last 15 years. Now, news of the Buteyko method is beginning to spread. Gowrie, virtually crippled by her disease and unable to work for the last 8 years, she's at the end of the road of conventional medicine.
Well, I do have a lot of hospital admissions. From March alone this year, I've been in 6 times. And then I have times where I don't go in. I try and treat myself at home. But I do take an awful lot of medication.
This medication rules Donna Gowrie's life. Her daily drug intake is immense, and she worries about side effects. The second patient Professor McNee offered us was self-employed plumber Campbell Stewart.
He's a patient who has chronic asthma, and by that we probably mean he has chronic inflammation in his air tubes, and has had a lot of difficulty over the last few months trying to control his asthma.
The last 3-4 weeks at work, I've been getting out of the car, walking 10-20 yards and really being breathless, coughing, you know, and spitting up phlegm in that city hospital with a doctor at knee, and he says, stop smoking, and with the course of tablets I'm going to give you, inhalers and everything, you'll be able to walk around the golf course in 2-3 years' time. And that's still happened.
Our test will take place at this Edinburgh hotel. The task is to make our patients significantly better in just 5 days. As the cameras home in for the first session, Sasha Stalmatsky is having a last chat with his mentor in Russia, Professor Buteyko. It all looks rather strange, but it does have a scientific rationale. Every time we breathe out, we blow off carbon dioxide. But carbon dioxide is not just a waste gas. We need a certain level of it in our blood for healthy living. Chronic over-breathing or hyperventilation leads to excessive loss of carbon dioxide. And that can bring a number of problems, including, the Buteyko people say, asthma. The narrowing of the bronchial tubes, which occurs during an asthma attack, and which causes wheezing and a feeling of breathlessness, is, they say, the body's attempts to stop you blowing off essential carbon dioxide. If you stop hyperventilating, carbon dioxide levels will rise and the bronchi re-expand naturally. 9:50 a.m., Friday the 19th of December. The patients are starting to arrive for the final day of the course.
Hi, Donna. Morning.
How are you doing?
I'm fine.
I hear you had a night out last night?
Yeah, I didn't stay too late. But about 10 minutes.
Donna, you're looking great, I have to say.
I'm feeling great.
Are you?
I've got a new lease of life.
I know, you're a different person. I can't believe it. Look at her. Eyes are spotted. Are you her husband?
Yeah.
Hello, pleased to meet you. I'm Sally. Hi. When was the last time you saw her like that?
Many years ago.
Yeah.
Not often anyway. It's a change getting on without her coughing all morning.
Are you not coughing as much at home?
Did we cough during the night?
All right. And
He makes more noise than me breathing. He's keeping me awake.
That's wonderful.
Take a small breath in, please. Breathe out. Hold.
There must be something in it, yeah. Because it's working on us. Working on me and Donna and the young girl as well, you know, Alexa. The improvement's just been phenomenal.
I don't know, I think it's just the relief the last few mornings of waking up. No coughing, no wheezing, no trying to get from one place to another and being breathless. It's just a great feeling getting up in the morning and being able to breathe.
Just before I came, I'd been off school a week and a half with asthma because I got bronchitis and I couldn't breathe properly. And I was on a lot of medication, but then I came here and it's got better.
I've cut my nebulizer. I've only had nebulizer twice this week, instead of 3 times a day.
I've not used any medications yet. I've cut down on everything. I've not used anything. And I feel I don't wheeze anymore. At the moment, I'm not wheezing.
It's now 3 months since the course, and Alexis comes along to give her verdict. With her, surprisingly, is her mother, who had been strongly against Alexis doing the course.
I didn't go along to the course because I felt it was a waste of time. My mother financed it for Alexis, and my mother is retired, and it cost her quite a bit of money, but I thought she was wasting her money. But Alexis and my mother were determined that they wanted to give it a go, and they went along, and they left the book for me to read, and I just ignored it, and I really thought it was a waste of time.
So where are you now then? Are you a convert?
Yes, absolutely, because she doesn't take anything. And I would not believe that possible. I would have said that that was ridiculous.
And you sustain this how? Just by doing exercises?
Yeah, and I think it helped more closing my mouth at night because I used to wake up every night coughing and wheezing, but I don't do that anymore either.
It's still very early days, but for a child who has been relying on drugs since she was 1 or 2 years old, to now be off them completely is a giant leap forward.
Campbell Stewart found the daily breathing exercises hard going, but worth it.
I've been really good for the last 3 months. It's a good 50 to 60% better. It's the best winter I've had for how long? 4 or 5 years.
Now, do you put that improvement down to the Buteyko method, or could it have come from something else?
I think it has. I mean, it's the only different thing I've been doing, you know, because I've cut down medication. I'm only on salbutamol inhalers, you know, when required. And Flexitide steroid inhaler, 2 puffs in the morning, 2 at night.
Did you ever really think it would do you any good?
No, to be honest with you, I didn't. It surpassed what I thought, because I didn't think any would have happened, to be honest with you. I didn't think it would have made any difference to me.
And what of Donna Gowrie? She's had her ups and downs, but is feeling positive.
Been a lot better. Definitely a lot better. Big difference. Everybody, my whole family, see a big difference in me.
Is that right?
Yeah. Even neighbours.
What do they say?
Just says that they've never seen me looking so good.
I suppose we have to remember that you've been a very severe asthmatic, and I mean, you were never looking for a miracle cure, were you?
Oh no, I wasn't looking for a miracle cure. I was just looking for something to help me.
And you got that?
Yeah.
But there's one more point about Buteyko. It could save the rest of us quite a bit of money. Indeed, according to Dr. Spence, it already has.
The simple fact is that in 34 patients, prior to Buteyko, they were costing £15,000 a year for their asthma medication. After Buteyko, they cost £5,000. That's a reduction of 2/3 in their drug bill. If this was extended to the rest of the country, very significant savings could be made.
I do find it surprising that the NHS is prepared to spend hundreds of millions of pounds on asthma drugs every year, and nothing at all investigating an apparently successful treatment like Buteyko. Clearly, Buteyko has some way to go to convince the doubters. That's why further scientific trials and someone to pay for them are so urgently needed to settle the matter. But it has to be said that our 3 patients don't seem to need much convincing. Alexis has joined a synchronised swimming class. Donna has booked her first holiday in years. And Campbell is finally able to pursue an old dream.